Clark County Today is presented by Cano Real Estate. Hire an agent, get a team. Learn more by visiting canorealestate.com.
Hey everyone, Chris Brown here, and welcome to the Thursday edition of your video update from ClarkCountyToday.com. We start as usual with a look at the latest details on the COVID-19 outbreak in the county. Since yesterday, there have been 4 more confirmed cases, bringing the county's total to 399. The death count remains at 24. With no new deaths since Tuesday, hospitalizations remain the same, with 10 confirmed cases in the hospital and 3 in intensive care. What would it take for Clark County to move ahead to the second phase of reopening sooner than other parts of the state? Well, that's what county councilors want to know. This week, they urged Dr. Alan Melnick, the county public health officer, to get more details from the state about exactly how much testing and contact tracing they require. Melnick says we've been averaging about 200 to 300 tests per day, but we need to be closer to around 500. The snag, though, isn't lack of capacity to test. It's a lack of people demanding them. Most hospitals are currently testing anyone who is admitted, and all of the homeless at area shelters have been tested, along with anyone at a senior living facility with a confirmed case. The county is working to get detailed testing data from providers in order to have a more accurate picture of what the true positive testing rate is. The state has said only counties with fewer than 75,000 people and no new cases in at least 3 weeks will be allowed to seek a quicker reopening process. So far, there's no sign the governor's office is ready to bend on those requirements. Well, as the number of COVID-19 cases decline, hospitals are urging patients not to delay treatment. Officials at Peace Health Southwest Medical Center have teamed up with more than 100 hospitals across Washington to urge members of all communities in the state not to put their health care on pause during the pandemic. Clinics across the state have reported abnormally low volumes of patients seeking routine medical care. At the same time, officials at those clinics report that visitors to the emergency department are arriving with more severe illnesses, having delayed care. That was the topic of a virtual Q&A held today by the State Hospital Association.
The stay home, stay healthy order had a major factor in regards to limiting the spread of the virus, but it was never meant to keep us or our patients from receiving the health care that they need. We have heard that there's beliefs that the healthcare system is so overwhelmed with taking care of COVID patients that we simply don't have the time to attend to others. And I guess I want to kind of bust that myth and really say that that's simply not true. We are here for you with or without COVID. We had, people thinking that they would be able to tough it out at home and came in with perforated appendicitis, which is a larger procedure and involves more time and risk, which could have been prevented if they could have come in sooner.
May is Stroke Awareness Month. So unfortunately, across the United States, we're seeing close to a 20% drop in those calling with symptoms of stroke. This is significant. If you or a loved one are suffering from a stroke, you need to seek treatment immediately. There are real consequences to delaying care. Ultimately, it is the difference between recovery and disability for you.
Now, that educational campaign is aimed at addressing the concerns keeping people from seeking appropriate care. Peace Health Southwest staff continue to take a number of steps to ensure the safety of patients. That includes the use of masks or other personal protective equipment by all caregivers and physicians, pre-screening before appointments, and temperature and symptom checks for anyone visiting its locations in person. Well, after having to toggle incredibly quickly to online teaching, many members of the Washington State University Vancouver campus faculty have begun research into areas related to COVID-19. Associate professors are teaming up in cross-departmental research studies on topics from how social distancing affects behaviors to the adverse effects on Asian Americans in the first weeks of the COVID-19 pandemic, and even how to help parents, especially single parents in a minority group, to do online learning at home with their children. Vancouver campus chancellor Mel Netzhammer produced a video that was part of the City of Vancouver's update a few weeks ago, including a shout out to the faculty researchers. Many faculty are also telecommuting from home, so the research itself is being done remotely. You can find out more at ClarkCountyToday.com. Well, members of the Ctrain Board of Directors were given an update this week on the impact the coronavirus pandemic is having on the transit agency. CEO Sean Donaghy told the Board of Directors that Ctrain ridership is down over 55% compared to the same time last year. But the good news is that Ctrain has the smallest decrease in ridership of any major agency in Washington state, despite the decrease in overall ridership. Ctrain continues to operate at as close to full service schedule as possible in order to comply with physical and social distancing requirements. Donaghy said Ctrain has routes that continue to experience overcrowding as a result of current guidelines. In those cases, he says they're forced to ask riders to wait for the next bus. Donaghy also reported that as the state begins to move into the governor's plan to reopen Washington, there are indications that ridership is beginning to return. Ctrain is using a portion of the $15.8 million in funding it received from the CARES Act to get through the first months of the economic crisis. Ctrain has also currently placed all non-essential spending on hold, has a hiring freeze in place, and has deferred a number of capital projects. In addition to that, 75 Ctrain employees, about 20% of its workforce, are currently on voluntary leave. Well, Chris Cavan by day, Casey Fresh by night. If you've been to a high school sporting event, especially one at Camas High School, you have probably witnessed Casey Fresh and his camera putting the focus on student life. For years, he's provided students and their families with pictures for free. Here's Paul Valencia with reports on this superhero.
Happy Thursday to you all. Here's a fun story from Camas. Chris Cavan has 3 hobbies: taking photos, editing photos, and social media. Wait, did I say hobbies? I meant superpowers. Because when Chris activates those 3 things, he becomes KC Fresh. Just like Clark Kent has other names, Superman, Man of Steel, Chris Cavan has KC Fresh, the man of focus.
Hello, my name is Chris Cavan from Camas, Washington. I'm out here today talking with Mr. Valencia about why I do what I do, my passion for photography. I'm very thankful for the city of Camas to allow me to go out there and photograph sports and fulfill this passion I have for taking great photos for a couple of reasons. 1, because I love using my camera. 2, I love Camas sports. And 3, I love all the smiles and all the thank yous and all the happiness it provides to the local families just by being able to freeze those moments in time for these people and these local athletes. I never dreamed when I started this program that it would turn into what it did. The thank yous, the smiles, the awards, the accolades, worth more to me than any money, any compensation that would be paid for all these photos. I enjoy doing it. It's a great community service, puts a lot of smiles on the faces, and that means the world to me. So with that said, I just want to say thank you to all of you from the bottom of my heart.
All right, thank you, Paul, and thank you, Casey Fresh. And there is your quick check of today's headlines from ClarkCountyToday.com. If you have a story idea you'd like to share, we would love to hear from you. Send them to news@ClarkCountyToday.com. If you do the email thing, you can also reach us through Facebook, Twitter, or Instagram, and be sure to follow us and be part of the lively conversation on social media. For all of us, I'm Chris Brown. Have a great evening. Talk to you tomorrow.